Welcome to Robin's Nest. I'm Robin Surdell. The incidence of Lyme disease has been an ever-increasing problem here in New England. Last year we taught you about protecting yourself and your family from ticks and the safest way to remove a tick from the skin. My guests today believe that Lyme disease may be more prevalent than earlier thought, and that treatment in some cases should not only be immediate but possibly prolonged. Please welcome my first guest, Dr. Kenneth Leigner. Dr. Leigner is a board-certified internist with additional training in both pathology and critical care medicine from New York. He's been actively involved in diagnosis and treatment of Lyme disease and related disorders since 1988. Welcome to the show.
Thank you for inviting me, Robin.
Very impressive credentials.
Thank you.
I wanted to go to the scenario that we talk about in the early part of the show. My child, I find a fully engorged tick, which is one that's been feeding a while, on my child. I remove it the way I'm supposed to, call my doctor. What can I expect?
It depends on who you talk to. There, like a lot of things in Lyme disease, there's a disagreement within the profession as what the best management is in that situation.
Okay.
Some physicians feel that one should observe and see if any signs of illness develop.
Right.
And there are other physicians who believe that it's prudent and appropriate to treat upon finding a tick, particularly an engorged tick, because if the tick is engorged, it means that it's been feeding long enough that if it is an infected tick, it has had adequate time to transmit.
To transmit not only Lyme disease, but there are other diseases as well.
Exactly, to transmit Lyme disease, but also we've been learning over the last number of years that ticks that can transmit Lyme disease can also transmit a number of other infectious diseases.
Okay, so my doctor tells me to wait and see. Do you agree with that?
Personally, I don't.
Okay.
I mean, I don't agree with it if the parent or the patient wishes to be treated. I think it's reasonable to treat. The reason is that the disease or diseases can be transmitted, and even Lyme disease can be transmitted, and some of the classic manifestations may not be apparent. So not every person who gets infected from a tick bite will develop a Lyme rash, so-called Lyme rash.
And that really concerned me because when we did the last show, Tom Forshner was saying that very few developed the rash. And so what then would we look for? If we're looking for signs, what are we looking for?
Well, there can be a wide range of symptoms. That's one of the problems. One of the problems in not treating upon tick bite is that you're depending upon either the parent or the physician to be able to recognize that the subsequent symptoms or signs of illness are actually related to that tick attachment, and unfortunately that doesn't always occur.
Okay.
So there may be a lack of recognition that when a person or a child becomes ill following a tick bite, that what is actually happening, if it's not classic, if you don't have a classic rash or some classic manifestation of Lyme disease, there may, the light might not go on that this might actually
in fact,
be
they
Lyme
may
disease.
even be misdiagnosed.
That's correct.
Can you tell me some of the possible misdiagnoses that would occur? I mean, we're talking about neurological problems, we're talking about physical ailments. What specifically, like what
well, there could be non-specific flu-like symptoms, malaise, sort of a lethargy, there could be swollen lymph nodes, there could be low-grade fever, and of course these things can be very non-specific.
Right.
And it might be hard to recognize that this actually signifies, the onset of Lyme disease.
And would that then occur during a specific period of time, like within a week of a bite or something like that, or is this something that could occur later?
Well, it could be quite variable. I mean, it might occur fairly, in close temporal relation to the bite, but it could actually happen a lot later, long after the tick bite is sort of forgotten or put into the back.
Holy cow. So this is a very elusive type diagnosis without specific testing.
Yes, it can be a difficult diagnosis to make.
Okay. My doctor now wants to do a test for Lyme disease on my child based on some symptoms that maybe he wants to rule that out. What kind of testing are we talking about?
Well, there's a lot of different levels of testing for Lyme disease. However, the most important thing at that point would be for the physician to take a very careful history from the parent and the child, as well as the child can speak, and do a very careful physical examination. And then, if it seems warranted, to go ahead and do testing looking for Lyme disease, other tick-transmitted diseases, and also to carefully consider if there are other diseases that, that might not be Lyme disease, that might be a cause of the symptoms.
Okay, so maybe like ruling out other things as well.
Yes.
Okay. Now, this is mainstream medicine. This is pretty much how, for me, when my child had a tick bite, I literally saved the tick because the Lyme Disease Foundation taught me to save the tick and call the doctor. And when I called the doctor, my pediatrician basically said, if there's no obvious symptoms around the bite area, there's nothing that's warranting an allergic reaction or anything like that, then just keep an eye on it. And after learning about Lyme disease during that first show, I was rather concerned about keeping an eye on it. When your patients get to you, what do you do with them?
Well, I do see some patients with early Lyme disease and do get calls for tick bites, but often I see a lot of the later cases that are much more complex.
So they're pretty sick when they get to you?
Very often they're quite sick when they come to me.
Now, do you suggest giving antibiotics after a tick bite?
Personally, I do. I mean, particularly if it's a type of tick that is known to be able to transmit Lyme disease, and particularly if it's engorged.
A fully engorged.
Because again, if it's engorged, you know certainly that it's been on long enough to be able to transmit. And the best opportunity to completely cure the infection is early. Because the longer you wait, this infection, Lyme disease infection, is a spirochetal infection. Spirochetes are quite complex bacteria, and they're able to get deeply entrenched in the body. And also, this type of bacteria has we're learning over the last several years that it can have a quite complex life cycle. And
so this is an organism that literally takes host. Your body becomes host to this organism.
It can, yes.
Okay. And these antibiotics will combat that.
Well, I think almost everybody in this field agrees that the earlier you treat, the better the outcome, and the easier the treatment is. So, from my point of view, if you can take, the earliest possible time, hopefully before the infection has had an opportunity to get widely disseminated, before it's had an opportunity to get widely deeply entrenched in the body, to me that's a golden opportunity to treat where you have the most chance of completely eliminating the infection.
And that seems to be true with a number of the shows we've been doing lately. We did a show on autism, and the doctor who was sharing her treatment plan said that the earlier the better, and that if we can cut these things off early, then it doesn't manifest itself into other parts of the body. Now, you mentioned that Lyme disease sometimes attacks a single organ when we were talking about this. And so what then would be the most common?
There's such a wide range of symptoms that can occur. Often we think of Lyme disease as being an illness that is multi-system in nature. That is, that there can be a wide variety of symptoms in a given individual, which can make it very confusing for the physician and for the patient or the parent.
Sure, sure.
Occasionally, though, Lyme will affect primarily a single organ system, so that you will lack that sort of multi-system flavor to the illness. So I'm sure everyone is familiar with a swollen knee, an arthritic type of presentation. It can present that way. It can affect the heart primarily, and there's a range of things that can occur with the heart, from irregular heartbeats to something called heart block, where the upper chambers of the heart are beating at a different rate than the lower chambers. And the pericardium, which is the surrounding of the heart, can become inflamed, or even the heart muscle itself can be inflamed. So then the other system that often is involved is the nervous system.
And that's where we get to the Bell's palsy type of symptoms, where they completely lose numbness or become numb on one side of the face
and can get weak
and can't actually move that. And certainly Bell's palsy can't. I saw a photograph of a child on the Lyme Disease Foundation website where the child had Bell's palsy, and it truly changed the look of the child's face, because the muscles just aren't moving. They're not doing what they're supposed to do. There's no nerve endings working there.
Well, often the Bell's palsy will resolve, with treatment. Sometimes even without treatment, the Bell's palsy will resolve. There are, rarer cases where the Bell's palsy is permanent. but that's not the usual scenario.
You mentioned also that there were behavioral problems that could result from Lyme disease, specifically in children, but even in adults. There were psychiatric or psychological issues that would come about.
Well, like I said, you can have mood disturbance. You can have personality changes in children and also in adults. Some people feel you can have true emotional disturbance with any manner of manifestations, from obsessive-compulsive type disorders to sleep disturbance, insomnia, even frank psychosis has been reported. Yes.
Now, is that because a particular part of the brain is being affected, or?
I don't think we know exactly the mechanisms, but certainly the Lyme disease organism can go to the central nervous system. We know also that the organism has the capability of actually entering cells of different kinds, including cells in the central nervous system. And that's another reason why treatment may be difficult, because we're not talking about a bacterium like a staph or a strep infection, which is, as far as I know, is an extracellular. It's outside of the cell where it's readily can be reached and destroyed by antibiotics. Spirochetes seem to be able to take residence inside of cells, where our treatments can be less effective than we would like.
Okay. I am rather concerned about some of the press that Lyme disease is getting today. Case in point, the New York Times had an article today stating that Lyme disease was actually becoming easier to manage and treat. You agree?
I don't agree.
No. Lyme disease is on the rise, or more widely recognized now? You're finding more cases?
I think that article might reflect what's called the bias of ascertainment. That means it depends on what kind of patients you see.
Okay.
If you only see early cases, then you may come away with the notion that it's rather easy to deal with. And on the other hand, if you see the more complicated cases, the cases that have already been around the block a few times, you realize that that's not necessarily the case. And many of the clinicians who deal with chronic Lyme disease, their practices are overwhelmed with extremely ill people who are having great difficulty getting diagnosed and getting proper treatment. Do
you think that the problem is that our doctors are not being trained in how to recognize Lyme disease, or that there's an issue with testing? What is the issue? Why are the specialists being so overwhelmed? And my pediatrician is telling me, it's okay. You just watch it.
Well, I think we're in a very early stage of our understanding of Lyme disease. We've known about Lyme disease really and been studying it intensively now for about 30 years or so. You can contrast, for example, with syphilis, which is another spirochetal disease. And do you know how long it took for medical science to really have a good understanding of syphilis? Well, but just let me tell you, it's taken medical science about 500 years to really understand syphilis as a complex, multi-system infectious disease that can evolve over time, that can have periods of latency where the person doesn't seem to be ill, but they actually still are infected, and months, years, or sometimes even decades later, they can show serious symptoms as a result.
And this is true for Lyme disease as well?
Yes, it is.
So do patients actually get well, or do they perhaps get to maybe a plateau and that's as well as they're going to get? What's been your experience on that?
Well, it's very hard to make a blanket statement because people respond differently, and some people can be infected and either with their own immune system, with or without the help of antibiotics, can sort of put the infection to rest and really don't seem to suffer serious problems. But there are other subsets of patients who have a very serious time with the infection, and even with maximally intensive treatment, it still remains a struggle to get them well.
I firmly believe that we are all our own advocate when it comes to our medical treatment, and so finding out more about this would certainly be a great thing to do.
I think, yes, I think it would be excellent for anyone, and particularly parents with children, to inform themselves as much as they can and learn about Lyme disease so they really have a better understanding. There are a number of excellent books out there. Karen Forstner has a book, I think, Everything You Need to Know About Lyme Disease. Denise Lang has a book called Coping with Lyme Disease. Plus, you know Polly Murray?
Yes.
Polly Murray is the woman who sort of got the attention of the Connecticut State Department of Health to investigate this outbreak of what was thought to be juvenile rheumatoid arthritis in old Lyme.
Turns out to be.
And it turned out that it was actually Lyme disease. And she's written a book called The Widening Circle, which is from St. Martin's Press. and that's an excellent book as well.
And certainly we're going to have those books available for you on our website as well. And certainly for more information about Lyme disease and what's happening with research, you can go to www.lyme.org, and that's the Lyme Disease Foundation's website. Thank you so much for spending some time with us.